Hello, and welcome to another seminar in our biostatistics series. Today, I'm going to be talking about data management, specifically quantitative data management. My name is Tanya Esterhazen, and I'm a biostatistician from the Division of Epidemiology and Biostatistics in Stellenbosch University. Firstly, the importance of good data management. I want to stress that data are a valuable resource. As you well know, you have spent a lot of time and effort and most probably a lot of money as well collecting your data. So you need to treat it like a very, very valuable commodity. And therefore to ensure that the data that you collect and enter and use for your research project are of the highest quality possible. This is important to ensure that you can interpret and understand the data that you've collected, and also to avoid duplication. We also need to ensure that the security measures that you use to collect and store your data are of the highest possible quality to ensure that you don't have loss of data or risk any damage or theft to your data. Often you will find that you need to comply with funding body or ethics requirements, and good data management system will definitely help you to do this. As I've mentioned before, data are a very valuable resource. So data sharing is often an option, or sometimes not even an option. Sometimes it's mandatory and required by the journal that you are publishing in to make your data set available for the public. And I don't think you'd want to do that if your data wasn't of the highest quality possible. So how do we ensure good data management practices? Obviously, we have to collect the data in a manner that is validated using well-designed questionnaires or data capture forms or data collection forms. You need to formulate a good data management plan. In the next slide, I'll go through some of the points and the steps in formulating a data management plan. A data dictionary is always a good idea to have. It not only helps you to remember what the data is that you've collected, but also helps others to understand your data. For instance, if you're collaborating with a statistician, they are going to need to know what your data is all about. Your standing operating procedures should also be followed for collecting and storing data, and that can also be part of your data management plan. So let's chat a little bit about a data management plan. It should include the following as a guide, but obviously there might be other headings that you want to use, or some might not be applicable to your particular study. Firstly, you need to define what type of data you will be collecting. Quality assurance measures also need to be spelt out and put into place in your data management plan. Any plans you have for data sharing, now these need to be thought about at the protocol stage, at the stage of designing your study, specifically because you might need to put in your informed consent forms the fact that you're intending on sharing your data, and your participants need to be aware of this and sign specific consent for this, otherwise you might not be able to share your data. Ethical and legal issues, copyright, intellectual property, and ownership of the data all needs to be thought about very carefully and go into your data management plan, as well as how you plan to store and back up the data. If you're working in a study where there are several people involved, it's a good idea to also specify the roles of the different key stakeholders in your study and what their responsibilities are. Okay, let's talk briefly about what type of data to collect. In quantitative data, there are basically two kinds of variables. Variables are the bits of information that we collect on our study participants. We get categorical variables and numerical variables. And categorical variables are generally of two sorts. We can get nominal variables and ordinal variables. The difference between them is that nominal variables are unordered categories, non-hierarchical, distinguished by name alone, and therefore called nominal. For instance, like how people classify themselves in terms of their racial group, or whether they're a smoker or a non-smoker, and how they classify themselves in terms of their gender or their sex. Whereas ordinal variables are those which are delineated into ordered groups or hierarchical groups. So we might have a system of pain scoring where we ask the participant or the patient to rate their level of pain from no pain, mild pain, moderate pain, and severe pain. So you can see that those categories form an ordered procession. So that's an ordinal variable, even though they're discrete categories. So it still falls under the sphere of categorical variables. The other type of variable is the numerical variable. And here we get two main kinds: discrete, which can only take on whole numbers. So if you ask a woman how many children she's had, or how many people live in the house, or how many episodes of a disease that they've had, those are discrete quantitative variables or discrete numerical variables. Whereas a measurement of something, if you're using perhaps a scale to measure the mass or the weight of the person, that can be a continuous variable because it can take on any value. It doesn't necessarily have to take on whole numbers. Okay, so most of your measurement variables will probably be continuous variables. Height in centimeters, birth weight of a baby in grams or kilograms, and many of the parameters that are measured in the blood. Okay, hemoglobin, albumin, CD4s, HIV viral load, those sort of things. Right, so it's very important to distinguish what type of data you're collecting. Next, we have to think about how to capture your data electronically and how to set up your data collection or do a data capture sheet. Because maybe you're collecting data in hard copy, in paper questionnaires, or using a data collection form, which is a hard copy paper form. And now you have to think about how you're going to capture this electronically. In the simplest sense, there's two systems you can use. You can either use MS Excel, which is possibly the most simple, easy way of doing it. And another way is to use REDCap. And I'll be talking a little bit about REDCap and telling you the differences between the two very soon. REDCap is supported by Stellenbosch University, free of charge for students and staff to use. And as you know, MS Excel is also part of your software suite that you have. So there's no need to invest money in an expensive database system where we have these two facilities available to us. This is an article that you can access. If you need a copy, it's open access. You can get hold of me and I can send it to you, but it quite nicely explains how data should be organized in spreadsheets. But I'm basically going to be telling you what this article is all about in the next few slides. So here's an example of an Excel spreadsheet where data has been captured from a research project, a quantitative research project. And this is kind of like what we like to see when you're wanting to get your data analyzed or to collaborate with a biostatistician to help you to analyze your data. As you can see, the top row is basically the names of the variables. So only row 1 has got actual words in it. Okay, so only row 1 should be used for the names of the variables. So in column A, row 1, ID, in other words, a study number or unique identifying number of the patient is recorded. This is not an ID number that can be linked to any system whereby the patient can be identified. It's purely from it's purely a study ID. Okay, it has no intrinsic meaning outside of the study. And that's a very important point. There should be no identifying features in your data set that can actually help to identify who the patient is. So no hospital numbers, no names, no addresses, no South African ID numbers either. Just a made-up ID number which you link externally to a particular patient if you need to know who they are later on for follow-up purposes. And then the next column is race, where it's a categorical variable that's been coded. So those numbers, 1s and 2s and 3s, represent different race groups that the patients have identified themselves as, and I'll show you in the code book how that can be deciphered. Age is the actual age in years with no units, please. Please don't put any units in the actual data set, otherwise the computer package that we will export this data to for analysis purposes won't recognize it as a number if it's got, say, kgs or years or whatever as units attached to the actual number. So just the number itself, please. And then the other variables are coded binary or coded numerical variables, so on. So basically all you should see from row 2 downwards is simply numbers, and that's how we like the data to be. This is an example of how it shouldn't be. Also in Excel, this person has tried to make it easy for themselves to enter data or for the statistician to see what's going on using color coding. When we take this data into our software packages to analyze the data, our packages are colorblind, so this color coding of yours means absolutely nothing. Also, this person has used about 5 rows of data, of lines to put headings in the different variable names and so on. And that is also not allowed. As I said, only 1 row should be used for the headings for the variable names. So from row 2 onwards should be the actual data. So some general dataset guidelines is to please use a single spreadsheet. Ideally, all data should be entered into a single MS Excel spreadsheet. If you have more complicated data sets, for instance, if you have multiple follow-ups of patients over time, or you have multiple tools that you're using to collect data, this is when an Excel database might not be appropriate, and you might have to use a REDCap database or some sort of database that allows you to relate your sheets together. Okay, Excel is simply flat files. So if you have a pretty simple study where you're just looking cross-sectionally at a variety of measurements at one point in time, a single spreadsheet should suffice, whereby you would also have 1 row for a single observation. If your observations or your units of analysis are patients or participants, each participant will have their own row of data all the way through. And the columns will be the variables or the bits of information that you will collect on your patients or participants. As I said, a unique identifier, which is untraceable to the actual patient, but is specific to your study. You can, elsewhere, you can link the identifying features with the unique identifier, but it should not be part of your electronic data set, especially if you're sharing your data with others. Each column must contain 1 variable. I think this is self-explanatory, but oftentimes students will try to enter more than 1 piece of information in 1 column or 1 cell. For instance, if patients are allowed to state all the symptoms they're experiencing, and they mention 5 different symptoms, the student might try to enter 5 different symptoms into 1 column. We would recommend rather different columns for different symptoms. The names of variables should be in row 1 only, as I've specified, and the variable names should be meaningful, short, and unique. So you can't have 2 columns with the same variable name. They need to be unique. Meaningful in that when the data is exported into a stats package and tables are generated or analyses are done, you must be able to know which variable is being spoken about by the name of the variable. So don't call it variable 1, variable 2, variable 3, rather call it age, weight, height, if that be the case. Short, because us biostatisticians who have to process your data, have to analyze your data, will most probably be using not point-and-click software, but where we have to code, and if we have to write out these very, very long variable names, type them out, there's more chance for making errors. Also, continuing with general dataset guidelines, please no punctuation either in the name of the variable or in the data entries. Names of variables have very specific nomenclature that is allowed by the stats package, so no spaces. If you want to separate words, use underscores. No punctuation at all. You can use alphanumeric characters only. Each field must contain either numeric data or text data, and please don't mix text and numeric data, as I've stated before. So if you have a continuous variable like age, don't put units like years in that same column. So if it's going to be numeric data, keep it purely numeric. If it's going to be text data, that's fine, but it will be difficult to analyze text data. So keep text strings to a very, very minimum. As I've said, limit text fields. Coding, I did mention when I showed you the data set that categorical data can be coded numerically. So for instance, sex could be male or female. Maybe you'll assign a code 1 to male and a code 2 to female. That's fine. The actual numbers that you use are arbitrary as long as you have a code book, which can be used for decoding purposes at the end of the day. So unless it's an ordinal variable, the actual values that you use to code are very, very arbitrary. An ordinal variable should be coded from lowest level to highest, where numerically the lowest level has the lowest numeric code. But I think that's very self-explanatory. Now, missing data can also be a problem. If it is truly missing data, rather leave the cell blank. If you want to, you can assign a code for missing, for instance, a code that hasn't been used before for that particular variable, like 9 or 99 or 999 are often used as codes for missing data. But this is only applicable to categorical data that's missing. If it's quantitative or continuous data that's missing, please don't put a 99 or a 999 because that could be mistaken for a real value and then really skew your results. Similarly, please don't use a 0 to mean missing because in some cases, a 0 can be an actual value. So when 0 can be an actual value, as in number of episodes of TB this year, 0 can be an actual value, then you can use a 0. But if you want to use 0 for a missing value, please rather don't do that. Or if you need to do that, then inform whoever's working with your data so they can set it to a system missing value. Dates should be in consistent format. You'll find that working with dates in Excel can be rather tricky. If you want to use DDMMYYYY formats, then do that consistently with all the date fields and don't switch to American date formats or some other date format throughout because it will be difficult to get it all into the same format when you're taking it to a stats package. As I've said before, no identifying data in your data sets. Let's talk about coding and code books. Categorical data should be entered as numeric codes, as I've said before. I mean, this not only makes it so much easier for the person who's entering the data, where they don't have to type the name each time. For instance, they don't have to type male and female each time when they're entering the gender or the sex of the person. They can just type the code, 1 or 2. So mistakes are much less common when you're using codes than when you're typing. Also, use consistent codes. It helps. I know you'll be using a code book, but for instance, if you decide to use a 0 code for the absence of a condition and a 1 for the presence of a condition, don't switch halfway through to 1 being the absence and 0 being the presence, because that's really going to confuse people. But if you use a code book, it should be decipherable as long as the person who's decoding will refer to your code book at all points. For example, Likert scale variables can be coded as 0 is strongly disagree, 1 is disagree, 2 is neutral, 3 is agree, and 4 is strongly agree. And if you have many, many Likert scale variables in your data set, you can keep this consistent coding, and that will make it a lot more easier to interpret. Yeah, and remember to also tell or keep a note of, in the code book, what your code for missing data is, if applicable. So getting back again to our well-structured data set, you'll see at the bottom there's a tab called Data, which is currently the tab that's open and what we're viewing at the moment. But there's another tab on the spreadsheet at the bottom next to the Data tab called Codebook. So it means that the codebook and the data set will be saved onto the same Excel file. So when you send somebody your Excel file, they'll have access to both your raw data and your codebook. So let's have a look at this codebook. When we click on the codebook tab, you'll see that the codebook is set up slightly differently to the data set, where the data set had the variable names in the variables in the columns and the data in the rows. Here we have in the columns, we have the list of all the different variables. In the first column, we have a description of them. In the second column, and then different information about the different types of variables in the subsequent columns. And each row here represents a different variable. So we can see that the variable name ID corresponds to the patient identifier, and its type is numerical. The variable race corresponds to a description, race, which is categorical and has two unique units, a 1 and a 2, and in the column codes, in column E, it tells you that 1 is equal to black and 2 is equal to colored. So that's all the information about the different variables, which is essential. You might find that you'd write this on a piece of paper or in your notebook that you're working with, and when you want to access the data in 5 years' time again, everything that you've written has disappeared, so it's best to keep it electronically with the data, and then you can't lose it. Let's talk a little bit about how to clean data and keep it uniform. The software is case sensitive, so if, for instance, you do have a text field and you're typing a variable in, or you're typing a bit of information in, and you use the word female, let's say, and you type it with a small f, the next time you type it with a big F in the same column. And if you want to analyze that data, tabulate the results, the computer is dumb. It will see female with a small f as a different category to female with a large F. So if you make any mistakes when you're typing text fields, the program that you use to analyze your data is not going to know what you mean and treat it as a completely separate category. So that's another reason for rather coding your data and using codes rather than using text. But if you do have to use text, then be consistent in how you're typing it. You can use the find and replace function in Excel to make multiple changes at once. This is for cleaning your data after it's entered, and if you find that you have made mistakes and you want to make it uniform, then you can use the find and replace function to do this. Garbage in, garbage out, that's what GIGO stands for. So if you hand your statistician or the person who's helping you to analyze the data that's not clean, has multiple mistakes in it, inconsistencies, the analysis that you're going to get back is also going to be fraught with these problems. So please make sure, and it is your responsibility to, after you've captured your data, to make sure that you've at least done some cursory cleaning of the data to make sure that it is not garbage. Storage, storage and backup. Please name your data files appropriately. If you name it my data or something like that and you email it to a statistician who's perhaps working on, at any one point in time, 10 data sets, they might get confused. So rather use a system for naming your data sets, like the name of the project or your surname, as well as a date. All your data sets should be dated, and never tamper with the original data set. Always keep the original. If you're making changes, save them with other dates. Use multiple storage systems, including virtual backup. It's not just good enough to store your data on your laptop and maybe on a memory stick. Please also use other sources that are available to us, like Dropbox and the cloud. It happens more often than you know that data will get lost, that laptops will get corrupted or stolen, and then your precious data will be gone. Also email it to yourself, but each time it must be password protected as well. I'm going to talk a little bit more about REDCap just now, but I just want to inform you that in terms of data storage, REDCap has a double entry validation system for security. So not only do you have to put in your password every time you access REDCap, but you also have to enter a PIN, a one-time PIN that is sent to you via your smartphone. So only you yourself as the principal investigator, as well as anybody else who you purposefully give access to your REDCap project, will be able to access the data as well as all the setup behind the scene for each project. And it's stored securely on the university's server as well. So you don't have to worry about loss of data. Okay, let's have a brief overview of REDCap. It stands for Research Electronic Data Capture, so its purpose is mainly for research data, but it can also be used for other purposes like quality control projects or even student evaluations, which I've used it very successfully for. It was developed by Vanderbilt University and is funded by NIH, so it's worldwide. It's a secure web-based application for building and managing web-based projects. At all participating universities that are part of the REDCap consortium, of which Stellenbosch University is, it's available free of charge for the researchers. It is very fast and flexible to set up data entry forms and surveys, and you can control access to the databases and the surveys by nominating and adding people to your project who are part of your team. So you could have your supervisor as part of your team, and you could assign the responsibilities and roles that your supervisor would have. You could have a data capturer who has access to the project as well, but only in terms of entering data. That person would not have the rights to delete any data or to download any data, for instance. So you can set up and specify the rights of each person on the project as well. This is what the login screen looks like. The onboarding is pretty simple. Once you realize that you want to use REDCap, all you need to do is go to redcap.sun.ac.za, enter your SU credentials, your username and password, and then a simple form is completed where you will request a REDCap project access. Before you can get access to the site, you need to download from your App Store or Google Play, depending on what kind of smartphone you have, something called Google Authenticator. It's free to download, and this is part of the dual authentication system that you'll use to access REDCap. So once you've downloaded that, you can then use it by following the instructions to create a REDCap project. So utilities of REDCap are to create data entry forms to ensure valid data entry. So even if you haven't got a survey, like an online survey that you're doing, even if you've collected your data already in the form of paper questionnaires, or you have used data collection tools or other forms to collect data, let's say from medical records or so, you can still use REDCap to create a form, an electronic form through which you can enter your data to ensure that you're entering it in a valid way. You can use it to create and manage online surveys. Now, this is the big plus, this big feature of REDCap, is it's so useful for managing and creating online surveys. A lot of us do studies where we want to send out emails to our participants, our intended participants, for instance, if we're looking at surveying the students of Stellenbosch University, and we can get access to a database of all of their email addresses. We can send out surveys via REDCap. All you need to do is set up your survey tool on REDCap, have a list, either in Excel or in Word, of all the email addresses of the intended participants, copy and paste that, and put in some rules in place about how you want to send these emails out. You will also get reports from time to time, or you can go and check on the system as to how many people, or who has responded and who hasn't responded, although the responses in the dataset won't be linked to the people themselves, so the responses are anonymous and confidential. But you'll be able to then send reminders to the people who haven't responded, which is quite nice because you don't want to send reminders to people who have responded, because that can be a bit irritating for them. And at the end of the day, you can see what your sort of response rate is, and that is very helpful for surveys. So it's really, really good for online surveys. It also helps you to securely store and share your data. As I said, the data are stored on the server and can be downloaded in any format that you specify. So it could be a CSV file, a Stata file, a SPSS file, or a SAS file, each time with the metadata as well. So it's much more efficient than actually creating an Excel file where the metadata doesn't come with when you take it into SAS or Stata. REDCap also supports reports and basic analyses of the data. So if you request it, it will generate for you a basic data analysis report of the results of your survey. So basic tables, basic bar graphs, if you just want to check interimly and see how your responses are going. And as I said, it can download into all these formats, which is really, really great for your statistician. So finally, just to help you decide for your particular project what to use, Excel or REDCap, you need to consider the scope of the study in terms of how many people are on the team. If you've got a big study, a PhD type of level study, and you have many people who are helping you, or they're all collaborating with you on the team, and they each have a specific role, and you'd like to let them all have access to various stages of the project and the data, then Excel might be better for you then REDCap might be better for you than Excel. How much data do you have to collect? If it's a small one-time project, like a cross-sectional study, maybe Excel is better, but if it's a long-running follow-up study with multiple data forms being used, then REDCap might be better. Again, if there's a lot of follow-up over time, if it's a long-running study, then REDCap might be better than Excel. If you're having somebody else who's entering your data, like a data entry clerk, then again, REDCap might be better than Excel, because you can give that person specific rights to do different functions on the data and not others. If you're really concerned about data security and you don't only want to store your data on your laptop, but you also want it stored securely on a server, then REDCap might be better than Excel. So in summary, here's the comparison of the two. REDCap has security features in place, like the double validation system for getting access to the project, whereas Excel doesn't, and as well as storing it on the server. The validation is also present in REDCap, but not in Excel. In REDCap, you can create lovely forms for data entry. In Excel, there is a function to create forms, but it's very limited. You only can have a very small number of fields on your form. Both are free. REDCap supports online surveys, whereas Excel doesn't. And REDCap exports into many stats softwares without losing the metadata, whereas Excel is only compatible for import into different softwares, but no metadata comes with that. So it all depends on the purpose of your study and how important these various aspects are to you. The learning curve for REDCap will probably be a little bit steeper than the learning curve for Excel, because mostly at some stage of our lives we've all used Excel. So we're all familiar with Excel to an extent, with spreadsheets. And now with REDCap, there's a slight learning curve, but I must say there's a lot of training material available. You can watch videos that help you through every step of the way. And there are dedicated support people like myself at Stellenbosch University and others who can help you to set up your REDCap project. So I don't think the learning curve is something you really need to be too worried about. And thank you for listening to this seminar. If you do have queries, please would you go to our website and contact the Biostatistics unit through the different contact options available to you. Thank you very much.